Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Daniel bin Muhammad Sahin, and this is my presentation video regarding my research review titled Electroencephalogram-Based Machine Learning Approach for Detecting Major Depressive Disorder from 2021 to 2025. MDD is a serious mental health condition that affects about 14% of people at some point in their life, and it is very common mental illness among young adults, especially women and those aged around 18 to 29. And currently, MDD is diagnosed by using a questionnaires and clinical interviews by using scales like Hamilton Depression Rating Scales. But these methods can be subjective and produce inconsistent results because it only depends on the patient's answer and the clinician judgments. The objective of this review are to analyze the current research trend in EEG-based machine learning approach for MDD detection from 2021 to 2025, analyze the challenges faced in this research area and the proposed method, and analyze the existing limitation and propose the promising direction for future research. Using EEG signals with the machine learning and deep learning to detect MDD has a significant benefits. First, EEG is non-invasive, meaning it does not require any surgery or cutting the bodies involved, because EEG only records the brain's activity directly by using the machines or IoT devices implemented with the machine learning or deep learning algorithm. Since MDD affects how the brain functions, these EEG signals can reveal the patterns that associate with depression. Then, machine learning and deep learning can help to extract these meaningful patterns from these brain signals. This could provide an objective support for diagnosis and help the clinicians, doctor, or psychiatry to make a better decision in a clinical settings. Researchers use 4 different solution methods to detect MDD via EEG signals. In early studies, they use classical machine learning models like SVM, RBF-SVM, and logistic regression. And this model relies on handcrafted EEG features, which had to be selected manually. Then, this method moved to deep learning in the recent studies, where CNN-based models like SparNet and XID-CNN has been developed that can automatically learn the features from the EEG data. This removes the need for the manual feature selection. There are 2 studies that use advanced models as the solution. These include multitask deep learning framework and tree-based ensemble models that can further improve the accuracy and handle the complex data. The validation method also has been improved as a part of the solution. Early studies use 5 or 10-fold cross-validation. Meanwhile, recent studies now use leave one subject out or LOSO that has improved the generalizability of the model. Several limitations has been identified from the analysis. First, data limitation. Many studies use small sample size of data. This happens because there is a lack of large and public EEG dataset. As the result, the model prone to overfitting, where it only works well on the training data but not on the new data. Second, methodological challenges. Some studies use high-dimensional or handcrafted features, which increase the computational cost and time. Deep learning models are also often treated as the black box. This means that the model produces accurate prediction, but we do not fully understand how they reach those decisions. Third, signal-related issue. EEG signals are very sensitive and can be easily affected by noise and physical movement, such as eye blinks and muscle movement, and these make it harder for the machine learning models to detect the patterns specific to depression or MDD. Hence, this will reduce the accuracy. Finally, there are clinical and practical challenges. Comorbid conditions like anxiety or other psychiatric disorder make accurate detection even harder. The use of multi-channel EEG in a machine or IoT setups also can be impractical to use in a home monitoring or for the large-scale screening, which limit the practical application of EEG-based models in the real life. Hence, future research should focus on the 3 main areas. First, there is a need for the larger and public EEG dataset. Larger datasets can allow the models to learn more reliable patterns, and researchers can use a better data augmentation techniques. Secondly, researchers should also develop explainable AI model. Explainable model would help doctors to understand the reasoning behind the model's decision, and this could increase the trust in the clinical decisions. Finally, future research should also improve the EEG signals to be cleaner by implementing a better noise reduction techniques. That is all from me. Thank you and Assalamualaikum.